Welcome back to The Morning Toast. We are very excited and honored to be sitting down with Dr. Deborah Birx, a physician and diplomat who serves as the response coordinator for the White House Coronavirus Task Force. She is a longtime health official who spent 9 years on the government's point person on global efforts to fight HIV and AIDS at the Centers for Disease Control and Prevention. Toasters probably recognize her in her fabulous collection of scarves from the daily White House press conferences. Dr. Birx, thank you so much for being here.
Glad to be here.
You are working tirelessly. You are looking fabulous while doing it.
Fabulous.
We appreciate both elements equally.
A medical icon and a fashion icon.
Love to see it.
My daughters wouldn't agree with you, but thank you.
They're wrong.
We know your time is valuable and we don't want to waste any of it. We got so many questions for you. I think that largely due to the fact that there's so much misinformation being spread out there and a lot of people are like nervous to ask questions. So when they knew you were coming on, you are the expert. You are the go-to person for questions. They were so excited to ask. I think most of our audience being young millennials are social distancing, but there's a lot of confusion as to what social distancing actually is. Can you give us the explanation official from the White House?
So social distancing means that you cannot at any time point be closer than 6 feet to any person for more than 10 minutes. So yeah, I know. So you're not exactly social distanced. So this is really quite important because it's all scientifically based on how respiratory diseases are transmitted and transmitted from your mouth or your nose to someone else.
And we got a lot of questions about it potentially being transmitted through surfaces. So if you touch something that someone else touched, can you get the virus through that way as well?
So that is the really concerning part because we touch a lot of stuff and we don't think about it. And so really ensuring hand washing is important, but it's not going to be enough in this case. You got to be aware of every time you've touched a surface, particularly a hard surface. So we don't think fabrics are as critical in transmission as hard surfaces. So if you've touched any hard surface, you need to wash your hands or you need to make sure your hands are away from your face until you can get your hands washed.
Yes, that's what we've been practicing.
It's hard not to touch your face, Dr. Birx. It's really hard.
Exactly, because we're used to the hair thing. So even moving your hair around, you will brush your face. And that will put the virus on your face, and then it's very close to your eyes and your nose and your mouth where it's transmitted.
Yes. Can the virus be transmitted through the air? For example, if I'm walking down the street to get only the necessities, and someone walks past me and they cough, and I walk through their cough, could I get it?
So that's a really critical question. And I think no one knows the actual answer to that. So I want to be clear. If I said never, people would find the one case. We do know with another coronavirus called SARS, the original one from 2003, there was one time that they thought it was transmitted through the ventilation system. But that's forced air. And so, if you walk past, if you're 6 feet apart, their cough cannot reach you. But it means that you always have to be aware of exactly where you are and where other people are.
Mm-hmm. And there are so many rumors about coronavirus. And one of them a lot of people are spreading, and I don't even know if there's any proof behind it, is that hopefully when the warmer weather comes, the virus won't be able to live in warm weather and will therefore die off. Is that true or even remotely possible?
Is there any evidence to suggest that?
So if you look through North America respiratory diseases and you look at our normal diseases that occur in the winter months, from flu to the actual original SARS outbreak that occurred in the winter months, to other viruses that we know occur in winter months. There's summer viruses and there's winter viruses. Winter viruses normally come up in November, peak somewhere around December, January, beginning of February, and come back down. So we're actually moving out of flu season right now. And so there's a lot of people who have, when you look at the original SARS data, get excited that it could have a seasonality just like SARS and just like flu. Because we've never seen this virus before, we can't definitively say that. We think part of the reason viruses like this are less in the summer is because we naturally social distance more and we're not all closed up in the same household.
Very
Right.
true.
That's very true.
Well, a lot of our listeners are either new moms, young moms, expecting moms. Have we seen anything about coronavirus in pregnancy or even giving birth in the hospital's situation? What can pregnant women
expect.
You know, that's a really important question because my daughter has 2 children. One is about 27 months and one is only about 10 months. I haven't seen them in the last 3 weeks.
Congratulations.
Congrats.
Yeah, well, thank
I'm
you, but I'm
sure.
social distancing, so I only see their pictures and their videos. But I think this is really very important because every pregnant woman is so concerned about their baby. And so there were only 9 cases reported out of China. We're trying to get more data. What I can tell in that very limited set and a couple different pregnancies and deliveries that have happened since is both mommies and babies are doing terrifically. And the mortality data still shows really only 3 total cases from around the world of individuals under 20 succumbing to this disease. So I think, and we don't know if they had pre-existing conditions. So to every pregnant mom, practice the same level of social distancing. What might be really great is you won't get all those colds because now, you know, you can't take medication and you're always getting a cold when you're pregnant is horrible. So this may help keep all of that down.
So when it comes to millennials who are quarantining themselves, a lot of people are wondering if you're starting to show symptoms, is it best to continue to quarantine yourself and just medicate and get better? Or are you supposed to go out and get tested and risking opening yourself up to other infections and contaminating other people?
So if you're a young person, i.e. a millennial, really, you should stay home and call your physician or call your mom or call whoever you're normally in contact with about health issues. There's new options now for actually your physician to be able to just talk you through called telehealth, so you can get information. Of course, a lot of the information is on the CDC website. I think the most important thing is to stay home and try not to infect the others in your household. So you're quarantined in your household, and now we're asking you to quarantine into a room, very separate. Yes. So double quarantine.
Well, for people who are experiencing symptoms, what are some medications that they can take that might help alleviate those symptoms?
So your normal over-the-counter cold medication, I just want to put a caution out for that because I obviously my 2 daughters and my 2 son-in-laws are all millennials. They have a habit of mixing medication. So read the back of the box, and if it has Tylenol, any kind of acetaminophen product, that's the only one that you really need to be careful with. You don't want to take really more than 2,000 or 3,000 milligrams a day of that. So when you're double medicating because you're taking like a Dayquil-like substance, and then you think, oh, I have a fever, I'm going to take Tylenol. Don't do that because the Dayquil and NyQuil already have Tylenol in it.
And so if someone gets infected from coronavirus and gets better, is it possible for them to get reinfected?
You know, it's a great question. And again, we never say never because, you know, you'll find the one case in a million. But so far, we believe, just like with any other virus, you develop an antibody response to that virus, as well as what we call cellular immunity. That's your T cells. So you have B cells that make antibody, T cells that are naturally antivirals. They're your first line of defense after your skin, these natural killer cells and T cells. And then you make antibody, and that's the long-lived substance. That's your memory substance. And there's no reason to think that you would get reinfected with this exact coronavirus. One that's a little bit different, potentially, but not this one.
Okay, and so I think a lot of people are wondering, like for the most part, most people are abiding by the rules. They're staying in their house in an attempt to flatten the curve. And for us, it's been almost 9 days.
I'm on day 11.
So we're curious,
Great.
Is it working? Is it working? Are we too late?
Are we flattening the curve?
So, okay, now this is a really important question because what we're seeing today are things that evolved over the last 2 to 3 weeks. So the people who are coming to the hospital today, remember it takes between 2 and 14 days to get infected. It may take another 5 or 6 days to develop symptoms. So now it takes a week to 20 days to get really sick. And then it takes another 3 or 4 days potentially to be hospitalized and another few days in the hospital, and that's all cascading. we mostly see the sick people. We don't see the individuals with the mild symptoms. So it's very difficult in 2 weeks alone to see the full breadth of what we're doing and how we're stopping infections. We're watching Italy very closely because March 8th, they really did what we are doing now. And so really seeing how Italy's numbers look, I think will inform us a lot because they're a week ahead of us, and then we'll have a real sense. I think the president is very interested in figuring out what do we say after the 2 weeks, the 15 days of stopping the spread. And we're looking at that every single day from a data standpoint.
And we'll evaluate then. We also have a lot of listeners who work in the health field. They're nurses, they're doctors, they're PAs. And a lot of them had a lot of questions about the shortage of personal protective equipment and what kind of plan is in place to help them get those types of supplies because they're struggling right now.
Yeah, so we're really trying to align the need with the supply. And you know how it is when you've gone to the store and the 3 people ahead of you bought all the toilet paper? There was some of that happening between hospitals and hospital systems and clinics. And so we're really trying to find out where everything is. Can that be moved around while we also release significant amounts from the stockpile? And that's millions of masks coming out of the stockpile and going into communities that really need it.
And another question we got for you is from people who might be a little confused about the symptoms because a lot of people are now having seasonal allergies and maybe being paranoid that they might have coronavirus. So what are the official coronavirus symptoms?
Okay, so allergies, you're right, can look, particularly in mild cases of coronavirus, can look very similar. But you shouldn't get a fever with your allergies. You can get a fever with your allergies if you get sinusitis. But I think we all know what that looks like and how that feels, and that's really pressure in the front of your face. If you're just having a runny nose and a scratchy throat and no fever, that's probably your allergies if you have a history of allergies. Now, if you don't have a history of allergies, they don't, although they do come spontaneously. This is not the season where they would appear out of nowhere. So I always get nervous when people are sick and they tell me it's their allergies. So let's all agree together that we're going to be honest about when we really know that we have a cold and not say that it's allergies. And if you have a cold, because many millennials, it may feel like a cold. It may feel like the flu. If it's either of those things, it's really important that you stay home. And then one last thing, we're finding new data out of China and around the world that some of the early symptoms may be GI. So that's another piece of all of this, that you may have early GI kind of symptom, gastrointestinal symptoms that then evolve into cold-like symptoms.
Got it. Yeah, so coronavirus is a hypochondriac's worst nightmare.
Yes. Well,
you could say.
Yes. And that's why it's really important that you all support one another. And I think that's so critical for you all to say, yes, no, I feel like that too. That's my allergy. So it's reassuring to each other and then really staying in contact with each other, reminding people to take their temperature.
Yeah, and people are really, I think, desperate to help. And I know that staying home is one of the biggest ways you can be helpful. But as a young, healthy person, is there something else we could be doing?
I think there's a lot you can be doing. One, you are amazing about creating social dynamics in a virtual way for communities. Yeah. And I think I'm really relying on you all to keep communities integrated and speaking to one another and feeling like they're still part of a community. Because the better a community is about self-isolating, the better the results will be for that community. So I think figuring out how you stay in touch yet be distant. And I know you can all figure that out. And then really how to keep informing your parents about some of the not so smart things that they're doing, because they're not always doing what they're supposed to be doing.
Right. Well, there are a lot of people out there, and even celebrities, who feel like the response doesn't match like the level of sick people or the amount of deaths. What would you say to those people who don't understand why we're taking such extreme actions?
They think we're overreacting.
Yeah. So I think this is really important because remember, by the time you see deaths, you've really let the virus get out of control. because I explained it took 2 to 3 weeks to get to that. It's a highly contagious virus. And so you can see what happened in Italy. They waited until they were seeing a lot of people die in the older age groups and then realized that they had such a significant problem. And you can go from thinking you've got this to where there's thousands of people in the hospital that are not being adequately cared for. So that's what we're trying to prevent across America by taking this early, responsive, comprehensive approach to really, I know it sounds theoretical, flattening the curve, but it is the difference between your grandmother and grandfather surviving or not surviving.
Right.
Well, is there any positive news that you can share with us? You know, something that might be optimistic or hopeful, something we're doing right, or any good news we're seeing?
Good stats.
I'm really impressed at how people have adapted to these guidelines and really ensured that they're following them. I'm also really impressed about how well people have worked between the Republican and Democratic Party and how well the private sector has stood up and said, let us help. I can tell you, I probably get 100 emails a day from different private sector entities saying, how can I help? What can I do?
Wow.
I have this, or I have the construction company. When we were able to figure out that the construction masks were identical to the hospital masks, one was green and one was tan, but they were identical in how they work. The construction industry found hundreds of thousands of these masks and donated them to hospitals. That's what's happening, and that level of generosity, stores creating senior times for shopping, all of this kind of innovation, it gives me incredible hope that there's a lot more innovation. I mean, what will get us through this is our innovation plus our dedication to each other.
So
Totally.
true. Well,
Love
you
that.
are out here doing the Lord's work. We really, really appreciate everything you're doing. I'm sure you're not sleeping. You haven't seen your family, but it's all for the greater good. And before we let
We
you
are
go,
so thankful.
we had one final question
Oh,
for
yes,
you.
because inevitably Hollywood is going to make a movie about this pandemic. Who would you want to play you?
We have some ideas.
Julia Roberts.
Oh,
Yes,
that's a good one.
that's
We
a
were
good one.
thinking maybe Charlize Theron.
I was thinking maybe Renee Zellweger.
Anyone could do you
Yeah,
justice.
but they're way young.
Well, Dr. Birx, it has really been an honor to get to speak with you. Thank you for taking the time, and thank you for all the hard work you and the entire task force are doing. We really appreciate it. And thank you to the Toasters for listening. We hope you have a great day, guys. We'll see you tomorrow.
Thank you. Thank you for your work.